If you are diagnosed as diabetes for the first time, when you are diagnosed as diabetes for the first time, how do you consider the correspondence sure enough? It is diagnosed as diabetes, and I think that those who are probably puzzled. However, before diagnosing it as diabetes, there may be doubt of diabetes, or it may be said that blood sugar is slightly high. Several years before being diagnosed as diabetes, you possibly had some risk of becoming diabetes, as such, overweight, overeating, and overdrinking, excessive drinking of alcohol, and some cause diabetes. However, it is useless to repent it now. I improve such a life attitude and think that it is good to correspond to diabetes positively. Naturally, although I recommend you to go to a hospital and consult diabetes medical specialist, I think that it becomes further very important to improve the life of one once again by oneself. The most important point is considering once again whether there is any condition and facing diabetes and living calmly from now. Although it is also important to know that the various complications related to diabetes in the future will happen. First of all, I think it is important to consider one's life attitude to diabetes step by step. The present situation of diabetes. Speaking generally, I think there are many diabetic patients. Now, those who may be diabetes are about 10 million. And if those who may have diabetes also included, it is said that they exceed about 20 million people. This shows that 1 of 6 persons is diabetes in Japan, and more, 1 of 5 adult Japanese is diabetes. About 20% or more of Japanese adults are the diabetic patients, and it is never rare illness. In practice, many people live coexisting with diabetes respectively. If diabetes management is neglected, eventually its life will be shortened. Especially, the fearful thing will be the case that causes myocardial infarction and cerebral infarction, and it causes a person to die in the future. Moreover, it will become blind owing to diabetic retinopathy. and the kidney worsens owing to diabetes, so dialysis therapy is undergone at last. There is a risk of leg rotting and cutting. I think it is most desirable to stop the situations as early as possible. The outline of diabetes. When a diabetic general outline is spoken, it is what is the most important for diabetes and how to treat diabetes. The first basic consists in your own life attitude, and I think that your meals influence about 90% of diabetic control. In addition to the management of a meal, the next important thing is moderate exercise. It is not intense exercise, but moderate exercises which is carried out light exercise continuously, such as aerobics, walking, swimming. We recommend you to carry out the exercise for 30 minutes every day or 3 times or more per week. And the patient with bad diabetic control needs to take diabetic medicine and have injection of insulin which lowers blood sugar. I think that it is desirable that you decide your treatment after consulting with your doctor, because the selection of oral medicines and injection medical treatments differ from each patient. Now, I go back to the illness of diabetes. The name of diabetes has been heard in various places, so I will speak about what kind of illness diabetes is. Originally, human body uses a certain amount of sugar in the blood, which is absorbed as nutrition into various internal organs and muscles. For living, healthy person can control the blood sugar with fixed range physiologically. Also, it is management of normal sugar control. When the fluctuation of range of blood sugar becomes high, and fixed range exceeds, the fasting blood sugar level and the blood sugar level after eating become high, and these situations are maintained, you are diagnosed as diabetes. Therefore, I think that diabetes is losing the effect of blood sugar control mechanism and becoming high concentration of sugar in blood. And what is controls blood sugar is called insulin, which is hormone. In order to control the fixed range of blood sugar, human body is well controlled by taking out insulin from the pancreas not to become the high blood sugar level and not to become its too low level. The blood sugar control loses its effect and insulin stops working enough. Or, in my opinion, the situation of shortage of insulin itself and going up high blood sugar level is also mechanism of diabetic onset, and the main mechanism of the blood sugar level becoming high. There is so much cause. Symptom in diabetes. There is much symptom in diabetes. A diabetic fundamental symptom is that the number of times of urination increases. In particular, the number of times of urination at night increases. The number of times of urination at night is 2 to 3 times or 5 to 6 times. And the symptom of another diabetes is thirst of the throat by drying. To drink water in large quantities are the symptoms of diabetes often observed. Furthermore, it is that weight decreases in spite of eating a meal. Even if it eats ordinarily and it eats so much, weight does not increase. In other words, polyuria, dry mouth, polydipsia, and weight loss are regarded as a diabetic symptom. I would like you to check once again whether such symptom is by yourself. We speak the diabetic cause of development of symptom to a diabetic. Therefore, we want a diabetic to improve a dangerous factor. At first, I think that the following person has to improve a point contributing to raise blood sugar level. Obese person. The person who is fatter than a common person. The person who gained weight very much in the past. Under-exercised person. The person who does not move though I eat than normal. Person disliking sports. Person with the stress. Person eating too much a lot of meat. The person that it is overwhelmed a lot of liquor. The person who overwhelms a lot of liquor without a meal remains and eating. The person that the lifestyle is not regular. Person of a meal or 2 meals a day. Or the person who I do not eat in the morning, and eat at noon, and eat a lot at night. And the person who drinks liquor every day. In addition, one of the causes that diabetes develops in is a gene. When your parents, brothers, relatively eminent relatives are diabetes, the risk that you suffer from diabetes will be very high. If you had diabetes, a risk of a brother and a child becoming diabetes will become high. Therefore, we think the management of the aspect of living of the family and the cooperation of neighboring people are important. Why was it diagnosed as diabetes? Diabetes is diagnosed based on the result of blood tests in almost all cases. You consider being given to such explanation by your doctor. Measurement of blood glucose is the most important as the result of blood test. In the case of fasting blood glucose levels 126 mg per deciliter or above, or postprandial blood glucose levels 200 mg per deciliter or above, I think that your doctor diagnosed you as diabetes. Furthermore, measurement of hemoglobin A1C is important. The value of hemoglobin A1C was changed in April Heisei 24. In the case of hemoglobin A1C value 6.5% or above, you are diagnosed as diabetes. When I said once again and any two, fasting blood glucose level 126 mg per deciliter or above, postprandial blood glucose level 200 mg per deciliter or above, and hemoglobin A1C value 6.5% or above are filled, you are diagnosed as diabetes in principle. In addition, probably, you may think that it is diagnosed as diabetes also when there is condition such as polyuria, thirst, preeclampsia, and weight loss, and there is a view of retinopathy, and diagnosed as diabetic retinopathy in ophthalmology. When measuring blood glucose, it is good to refer to the one before breakfast. In the case of 70 to 109 mg per deciliter, or 110 to 125 mg per deciliter, or 126 mg per deciliter of above of fasting blood glucose levels before breakfast, you are classified into healthy, borderline diabetes, diabetes, respectively. Furthermore, the blood glucose level becomes a peak from 1 hour in 3 hours after a meal. It is thought that the normal ranges of postprandial blood glucose levels are less than 140 mg per deciliter, and it is considered diabetes when they are 200 mg per deciliter or above. Please check your blood glucose level. Although the word hemoglobin A1C was mentioned above, what is hemoglobin A1C? Hemoglobin A1C is the glycated hemoglobin in red blood cell, and it is denoted by percent as the rate of the glycated hemoglobin to hemoglobin. Hemoglobin A1C reflects the glycemic status. Considering the lifespan of red blood cell, it is thought that hemoglobin A1C reflects the average blood glucose level from 2 months ago to 1 month ago. The normal range of hemoglobin A1C value is 4.7 to 6.2%. Since the person with a high hemoglobin A1C value becomes myocardial infarction and diabetes easily. We recommend medical examination every year. Please consider 6.5% of a hemoglobin A1C value as one of the standards of diabetic diagnostic criteria. However, diabetes is not diagnosed if only hemoglobin A1C is used. Fundamentally, diabetes is diagnosed combining hemoglobin A1C and a fasting blood sugar level, or hemoglobin A1C and postprandial blood sugar level. When diagnosing diabetes, I think whether there are some persons who drank sugared water. This is the most fundamental diagnostic method for diagnosing diabetes by measuring the blood glucose level before and after drinking 75 grams of glucose. By this diagnostic method, when the blood glucose level is less than 110 mg per deciliter before drinking and is less than 140 mg per deciliter 2 hours after drinking, it is judged that blood glucose level is normal. When the fasting blood glucose level is 126 mg per deciliter or above, or postprandial blood glucose level is 200 mg per deciliter or above 2 hours after drinking glucose, you are diagnosed as diabetes. The above is the fundamental method of diabetes diagnosis. Diabetic classification. Although diabetes has very many classifications, it roughly divides 4 types. It is type 1 diabetes at first. Many children and youth are said to be type 1 diabetes, and the development of symptoms is very rapid, and insulin is indispensable to medical treatment. When medical treatment is overdue, consciousness may be lost, or it may die depending on the case. When you code type 1 diabetes for the first time, it is desirable to certainly go to a medical specialist or hospital immediately and to treat. And if insulin injection starts, please keep in mind not to stop insulin for judgment of one. If interrupted, it will return to a hyperglycemia again. Therefore, it is the principle of medical treatment that type 1 diabetes strikes insulin throughout life. Next, type 2 diabetes. I think that 90% or more of the diabetic of present Japan are type 2 diabetes. There is a fundamental hereditary background. For example, parents, brothers, and a near relation has diabetes comparatively, and if there are an environment factor, what is called overweight, lack of exercise, stress, alcohol, aging, etc. In addition, the symptom of diabetes will develop in high rate. Although diabetes develops in 40s and his 50s in male, and in 50s and 60s in female. It happens even if younger. You may think that diabetes develop in the very wide age group, which also shows the symptoms of advanced age. There are some patients who can control by a meal and movement fundamentally, and the medical treatment requires those who take the medicine which lowers blood sugar, and an oral medicine, and also those to whom control stops also attaching an oral medicine, and strikes injection of an insulin, etc. Since the medical treatment is various, I also consider that it is necessity to often consult with a doctor and also to make an effort in respect of a life by oneself that blood sugar should full be controlled. Next, gestational diabetes mellitus, GDM. It is said that GDM are easy to develop in those who is overweight, gives birth at advanced age, has family history of type 2 diabetes, and pointed out hyperglycemia at the past pregnancy. There are some patients who show the symptoms of type 1 diabetes at this time. Even if nothing is said until now, suddenly the balance of various hormones may collapse in the situation of pregnancy, and it may show the symptom of diabetes. Recently, such GDM has been increasing. Therefore, I would like you to put the correction of a meal and overweight in order by yourself. Since the child who will be born if control is bad in early stages of pregnancy is also taught that there is very much influence. Controlling exactly from the first stage is very important. And since it is a principle in that case of GDM to use not medicine but insulin, when control is bad by the meal and an exercise cure. You also understand this point well, and I wish to think. Please consult with a special doctor. Next, diabetes by other causes. This also has very many kinds. The gene related to various diabetes these days is discovered, and the illness whose symptoms are shown by the gene abnormality is distinguished as diabetes by other causes. I think that many causative genes are known if a gene analysis will progress from now on. In addition, it is called secondary diabetes, and the patient who grow hormone and adrenal cortex hormone and thyroid hormone are secreted superfluously. In the person with burned pancreas, pancreatitis, and pancreatic cancer, the illness of internal secretion. Furthermore, liver disease, hepatitis, liver cirrhosis, and fatty liver are called diabetic cause. Since there are some other illness which is developing diabetes, please consult with a doctor well. Diabetic complications. Although it was said that blood sugar level was high, you may think that it may let things go as it is since there is no sick condition. However, even if any condition is not now, various diabetic complications will be certainly happen. First of all, it speaks about the essence of diabetic complications. There are complications peculiar to diabetes. They are diabetic neuropathy, retinopathy, and nephropathy. It is said that neuropathy will be encountered in about 2 or 3 years, and retinopathy will start in 5 or 6 years, and nephropathy will be happened 8 or 10 years after diabetes developed. Neuropathy begins from a numbness of a leg cramps, and a pain. Gradually the range spreads, and if control is bad, it will happen early and it will advance. If you get retinopathy, a vein will be made in the blood vessel on the backside of eyes, and it explodes, and cerebral hemorrhage in the eyes will be caused and it will become blind. The number of patients of loss of eyesight from diabetes is the second cause of the total number of the patients of acquired loss of eyesight. The next is diabetic nephropathy. Now, it is said that the first cause of the dialysis in Japan are diabetes. Therefore, you must consider that it is certainly dialyzed and getting renal insufficiency if it lets things go. Moreover, there is another diabetic fearful complications. The arteriosclerosis is related to a life. Typical arteriosclerosis are angina, myocardial infarction, and cerebral infarction, and influences to the diabetic patient's future prognosis. If you got myocardial infarction and cerebral infarction, I would like you to recognize well that the possibility that the frequency of death increases high 5 or 6 times is high. You may have it thought that 10 years of the diabetic patient's lives are short because are based on such causes. Moreover, there is one more diabetic complication. The arteriosclerosis leg suffocation. A leg rots and it must cut a leg. This is also very frequent complications of diabetes. Diabetes is related to 3 major causes of its death in Japan. Diabetes is said to be very closely related with apoplexy and cardiopathy. Then, about whether the cancer, the first cause of death of Japanese, is related or is not related with diabetes. It is said this day that the relation of diabetes and the various cancers are also high. I would like you to consider a life of yourself. Therefore, that all 3 major causes of death are related to diabetes. It is good to live so that the blood sugar level may be brought as much as possible close normally. Furthermore, dementia also starting easily or coming to start early in case of diabetes These days is also said. It is said that various illnesses are related to diabetes now. Diabetic therapy. If diagnosed as diabetes, what does it do? I think that there are more ideas with influence not taking place to a life of it immediately, just because it was diagnosed as diabetes. There may be no subjective symptoms, and it may seem whether it should live and it is as before. However, if sick management is not carried out exactly, complications about which previous spoke will happen. Therefore, I would like you to consider performing diabetic blood sugar management appropriately in the first. Moreover, high blood pressure, cholesterol, and neutral fat may become high, and a diabetic patient may raise the frequency of myocardial infarction or cerebral infarction if a diabetes for a long time. And the protein comes out in urine, renal function worsens and becomes dialysis from renal insufficiency in many cases. Therefore, it is important to put a periodical inspection, etc. And to think that diabetic whole body control is required. It is thought that there are very many patients who are having overweight merged in case of 2-type diabetes. Therefore, when being diabetes now who are growing fat, I would like weight loss first of all by thinking the meal with sufficient balance. Although weight is not necessarily suddenly dropped, since rebound will be caused if weight is dropped much rapidly. I would like you to consider 0.5 or 1 kilogram of weight loss in 1 month, and dropping weight gradually. In that case, a body mass index, BMI, the number of 22 is proper weight. Where are their proper weight and ideal weight? Since ideal weight is calculated by multiplying the square of height by 22, this should be subsided within the limit of 22. If BMI is 25 or more, it is treated as sick. So, it is important overweight to put loss in quantity as much as possible. Furthermore, the kind of obese to be the problem recently. Metabolic syndrome is built-in fat type overweight. Built-in fat type overweight promotes arteriosclerosis, and the blood sugar level becomes high with high blood pressure and hyperlipemia. Since the risk of causing myocardial infarction and cerebral infarction will also become high if metabolic syndrome merges, we recommend you, for the total fat area of built-in more than 100 square centimeters, to decrease first the quantity positively. Next, there are complications of high blood pressure and hyperlipidemia. High blood pressure exists in 40% of diabetic patients. And it is said that the symptoms of hyperlipidemia are also shown to about 30% of diabetic patients. If it sinks as a factor, which is the SYNC2 related, respectively, and promotes the atherosclerosis, this should not necessarily control only the blood sugar level, and I will regard it as it being necessary to manage high blood pressure, high cholesterol, high neutral fat, and overweight collectively. Systolic arterial pressure should be managed by less than 130, and diastolic blood pressure should be managed by less than 80. As for total cholesterol, less than 200 and LDL cholesterol, less than 150 HDL cholesterol, the good cholesterol more than 40, and the neutral fat less than 120 should manage for the purpose. If it becomes diabetes, it is shown again how it treats concretely. We recommend you strongly to give priority to and manage a meal before movement in the case of diabetes. Management of a meal is about 90% of a whole management, and management of movement is 10% of the whole management. You may think that diabetes treatment is influenced by a ratio of this level. Though a diabetic medicine is used or insulin is treated, if the control of meal and movement have not been performed, overweight is advanced rather and glycemic control never becomes good. In the case of a house, it will be shaky when the foundation is not putting in order. Please manage firmly the meal, movement, and weight which your foundations like it, and control diabetes. The foundations of the diabetic treatment are the dietary therapy to the last. The foundation of dietary therapy are taking the proper balance of ingestion, suitable energy, a nutrient, carbohydrate, protein, and lipid must be taken by proper distribution. It may consider an ideal that the meal content ratio of carbohydrate, protein, lipid are such for 60%, 25%, 15% of the whole. Furthermore, I would like you to make it to a rule eating 3 times at morning, noon, and night, 2 times a day meal. For example, morning and noon or morning and night will become a cause which disturbs control on the contrary, and may increase the amount of meals at each time. Based on that point, I want you to divide a suitable calorie for a meal equally 3 times a day exactly. The doctor and the dietitian are guiding the intake of a meal so that it may become seen gradually to the person of overweight. To certainly measure one's weight and to perform the management is desired. There are many the patients to whom diabetes control becomes good only by dietary therapy. Furthermore, in the case of high blood pressure and high cholesterol, salt restriction and dietary restriction of cholesterol are required. In the patient of high neutral fat I also think that it is an important point that dietary restriction, such as sweet things, fruit, and alcohol restriction, are performed. In consideration of the patient's corpulence degree and height, it decides what kilocalorie is suitable for a day. 1,600 kilocalorie is required when height is 160 to 170 cm for male, and 1,400 kilocalorie is required when height is 150 to 160 cm for female generally. Energy distribution is carried out on the basis of this, and the contents of the meal are checked. I think that it is desirable to calculate suitably whether the balance of its meal is good after consulting with the dietitian, since food is divided in 6 groups: carbohydrate, fruit, protein, lipid, dairy products, seasoning. However, since alcohol was not contained in this energy, it would like the family doctor to check propriety of drinking about alcohol. Exercise for a diabetic. The diabetic does not have to do strong exercise. We recommend an easy aerobics for about 30 minutes, for example, walk 30 minutes, bicycle 30 minutes, underwater walking, and so on. In order to use muscles of the whole body, it is said that a walk is the most desirable. Since about 70% of the whole muscles are used, especially the walking with shake your arm is recommended. It is thought that the walk, which is a grade which a pulse goes up for a while to an extent that it gets out of breath a little, is desirable. Please consult with a family doctor for details. Since a person with the bad heart, a hypersensitive person, etc., may become other sick by exercising suddenly, please take care. The oral medicine for diabetic. The foundations of diabetes medical treatment are the amount method of meals and exercise cure. However, when not working, it is necessary to undergo the further advanced medical treatment. In that case, please think that a diabetic oral agent, an oral anti-diabetic, and insulin injection contribute to medical treatment. You must not take a medicine in large quantities from the beginning, but it's begun from a small quantity and increases quantity gradually. As for insulin injection, it is desirable for it to be cautious of hypoglycemia and to carry out according to conditions. Since the blood sugar level may fall too much in some oral medicine, SU agent, and insulin treatment. When hypoglycemia is caused, it is necessary to take in grape sugar promptly. Those who are taking medicine which raises hypoglycemia, those who are injecting the insulin, an incretin agent, and GLP-1 agent need to get glucose and always need to put into a pocket or a handbag. Since GLP-1 agent has come out in addition to the insulin, please check which injection is used. I think that insulin is well used to persons of type 1 diabetes and 2 type diabetes. Although I think that incretin is well used to person of overweight these days, it's used also to the person of 2 type diabetes. Even when you use which, please use it after consulting with a doctor on an advantage and side effects. Conclusion. In the case of diabetes, dietary therapy is the most important. A meal with sufficient balance which is not had for which a meal and overeating is desired. I base on dietary therapy and think that it is to the first foundation to treat diabetes naturally. The foundations of this dietary therapy, a doctor and a dietitian, the nurse, often being consulted with and depending on the case. I think that it is important that I have it checked whether it is appropriate to always take what meal, and it is a serious happening that I have the point whether balance has collapsed again, whether its meal is a meal as directed checked. If glycemic control is good, even if it is diabetes, you can lead a life which is not fundamentally different from a healthy person and hardly changes a life either. In fact, even if it is the patient of the diabetes of 100 years old, those who are living ordinarily now come. Considering that, even if it is diabetes, it is not sad, or it does not feel sad, or is not worried more than needed. However, you must not be optimistic. After undergoing various inspections, also including reflection of the life by self, I will often consult about the point the medical staff side, and it would like you to check an uncontrolled state. If diabetic control is putting in order, marriage, pregnancy, and childbirth are also possible and can also go to overseas like an ordinary person. After often consulting the doctor's side about drinking and smoking, I think if you check about the propriety of use, he does not forget to be influenced by better life throughout life of the diabetic.